I didn't know. Montel, are we missing somebody?
I thought you were in the middle.
Is that all the panel? Because we should be that. It looks like we separated them by something.
No worries.
No, that was bizarre.
I'll take that chair behind us.
Oh yeah, that's a good idea. You want that to be a
2 hours.
Yes, please.
Hold on, okay.
Yes.
Hi, everybody. I'm Lee Herholzer from 9Health 365. I'm the VP of Communications and Marketing, and I want to thank you all for coming today. It's such a gorgeous day outside today. I know you have a lot of other things you want to be doing outside, so that's why we really appreciate you being here today. So, I'd say I want to thank all of the organizers. Where's Denzel back there? Denzel. Thank you so much for being our ringmaster for this.
Absolutely.
And then also want to thank all of the volunteers, all of our sponsors, all of our donors, our panelists, our moderator, and also want to let you know that we also have a vaccine clinic going on across the street at East High School. And that vaccine clinic, the COVID vaccine clinic, will be going on until 2 o'clock today. So 9Health is proud to continue our mission to support health inequities and finding different ways that we can build in our community as far as vaccine hesitation to the Latinx and to the Black communities, to get them educated and up to date on where we are so far and encourage them to get vaccinated. So I'm going to introduce our moderator. This is Jean Pasha Sr. as of 6 years ago. He's an experienced moderator. He's an 8th grade math teacher, so I'm sure he's very patient. And he's also a previous Denver School Board candidate. So thank you very much.
All right. Good morning, everybody. I just want to say thank you to everybody for being in attendance today. I'm really looking forward to this conversation. It's something that's very important to me. As she stated, I am an 8th grade math teacher, and I've been teaching for about 5 years. And I teach a predominantly Black and brown student body. And I saw firsthand, not just my own personal experiences, but also the experiences of a lot of Latinx students and a lot of Black students, and how through that pandemic, a lot of families were awarded the benefit of being able to work from home and things like that. But a lot of the families that I dealt with directly did not have that luxury. And we kind of saw the inequities that exist in healthcare kind of amplified and really put on display as we were navigating that pandemic. Some of those deep-seated inequities in healthcare communities of color amplify social and economic factors that we all know existed, and sometimes one of the silver linings of this thing is that we had an opportunity to have it amplified and a microscope kind of put into what is going on in our communities when it comes to healthcare and access to quality healthcare. Recent news reports indicate that the pandemic disproportionately impact communities of color, compounding long-standing racial disparities. If you go back to things like Tuskegee experiments and the whole OBGYN industry as well was built on the backs of slaves. So we have to understand where we were in order to prevent those things from happening. We have to know where we've been so that we know where we're going. And as we discuss these things, we want to make sure that we're identifying some of those struggles that our Black and brown communities have had along the way. People of color are at an increased risk for serious illness. Some of that is epigenetic, some of that is just redlining and being in poor air quality and things like that, and how it permanently changes our body's ability to fight disease. So we have to remember that we're more likely to be uninsured and to lack a usual source of care, which is an impediment to accessing COVID-19 testing. I commend Mayor Hancock when the vaccine was rolling out. He was very purposeful in making sure that we had access to the vaccine in communities that have often been ignored. So we have to make sure that we're continuing that work to make sure everybody has access to quality health care. We're also more likely to work in the service industry. Many of my students' families just continued life as normal when the pandemic first hit. I had the luxury of teaching at home, but all of my students, most of my students' families had their grandparents were there, and we're talking about multi-generational households where one person got sick, grandma was likely to be infected. And I had students that lost family along the way, and seeing the trauma that caused so many students, it was hard for them to be able to focus on learning when they have so much trauma going on at home, being isolated from their parents who had very, very serious illness or contracted COVID and had to leave their home, stay in a hotel, and pray that their mother was okay 2 weeks later. Those are the type of things that we're talking about when we want to make sure everybody has access to high quality health care. Housing situations, as I talked about, make it difficult. Like if you have 15 people in the home contracting COVID and having it spread to your family is a lot more, especially when you have older grandparents and things like that in the building, and we have to pay extra close attention to make sure that they're okay. We're working in jobs that are not amenable to teleworking and use public transportation that puts people at risk. We got to remember that especially when we have those variants that spread a lot more easily, we have to be mindful of the things that we do in the situations that our families are in and try to make sure that they have access to the things they need in order to be protected, whether that's PPE or access to vaccines and quality health care along the way. Some data that we have for our Black and brown community, specifically our Hispanic families, they're more likely to have anxiety around the COVID pandemic as well, where 47% of the general public has anxiety, but that's over 60% in our Hispanic families, so they have a higher anxiety when it comes to surviving and moving through this pandemic, and as it hopefully turns to an endemic, and hopefully we can get to a point where we can navigate it and live lives as close to whatever the new normal is going to be. We want to make sure that the trauma that has occurred for too many families that are Black and brown, they have confidence in the healthcare that they're going to receive. So we're here today to talk about some of those things and what the experience through the pandemic has been like, but also where can we go from here to make sure that healthcare continues to be more equitable and we can get rid of some of those inequities that exist. So I'm looking forward to hearing everybody's introduction today. We have a very diverse panel, a lot of different perspectives, so I'm going to enjoy moderating this discussion. And we're going to have every panel introduce themselves. You have about 2 minutes to say what you have to say. And I look forward to moderating this discussion. And I'm going to start here.
Hello, I am Sergeant Stephanie Lang. I am the recruiter for the Denver Sheriff's Department, and I am born and raised in Denver, Colorado. I grew up in Park Hill, 32nd and Camaria, and so the Black community is very important to me. Now I serve as a servant leader in the Black community and just in Denver in general, and I'm really happy to be here. I will say that we have done a lot in our jails to make sure that we're keeping our inmates safe. I'm sure there's a lot of the questions that we'll be able to go over, some of the things that we did in detail, but we were definitely instrumental in making sure that we were doing our very best to provide PPE for our officers, as well as our inmates, as well as, just making sure that we gave them incentives as well to move forward with getting the vaccine. So I'm really excited to be here.
Good morning. My name is Chantal Lewis. I serve on the board for the Regional Transportation District, RTD for short. And I'm very excited to be here. Thank you so much for the invitation. We struggled a bit at the beginning of the pandemic to make sure that we had the proper PPE for our operators and what we needed to do to keep our customers safe. And so to be completely candid with you, it was quite a fight at the beginning of the pandemic to make sure that folks weren't having to choose between their lives and their livelihoods. And quite frankly, they were. And so happy to talk more about what that fight looked like and kind of the pressures that we needed to put on the agency as a whole to make sure that our operators and our customers were safe.
My name is Maria Gonzalez, and I am the founder and CEO of Adelante Community Development, which is a nonprofit organization serving the Denver metro area. And traditionally, our organization has been focusing on entrepreneurs and small businesses. And when the pandemic started, we had to pivot to what was important, what was needed, and what was an emergency. You know, listening to our small businesses of their situations, hiring, firing, letting go of people, closing, not closing, all of these health measures that were taking place with very minimum collaboration with small business owners and messaging, direct messaging, and just confusing messaging from city, county, state, federal level. And you know, we had to pivot it, even though our organization had never worked in vaccination efforts or any health-related efforts. We immediately realized the importance of getting involved and making sure that nobody was going to be left behind through this process, and requesting accountability for vaccine equity, and requesting every accountability for access to information and education and better ways that we can really be empathetic to what is going on, and how do we collaborate with larger organizations that are already in the field of health and can bring that equity that was needed immediately. And we continue to learn. Our Latino community that we serve continues to struggle in so many different areas, and so I'm happy to be here today so that we can share our resiliency, but also explore more collaboration and bridging those gaps in services to our community. So thank you.
Good morning, thank you for being here. My name is Dr. Ryan Ross. I serve as the, what do I do? A bunch. But I serve as the Associate Vice Chancellor for Student Affairs, Equity, and Inclusion for the Colorado Community College System. And essentially what that means is I'm the Chief Student Affairs Officer, and I work next to our Chancellor looking at equity across our system. We are the largest higher education institution system in the state. We have 13 community colleges across the state, around 115,000 students now. Used to be a little over 130,000, but we're seeing some enrollment challenges for a variety of reasons, and one of those is the pandemic and COVID-19. And so when we think about just what this has meant, not only do we have to pivot quickly, we have to think about employees, we have to think about students, we have to think about different target areas, different communities, different layers of opinions and leaderships and decisions, you know, between state, local, regional, federal, right? And most importantly, the wellness of our students. And so, you know, students shifting online. We literally had a week to take 13 colleges online, which may sound easy, but it wasn't, right? We had to help our faculty, we had to provide the faculty development to switch. We had some faculty who never had to teach online before, and now their total curriculum was. So we had a lot of things to think about, a lot to do, and we still are working through it. So I know a lot of people are optimistic, but I'm still very much of the opinion that we are still very much in the pandemic. And so we need to be thinking about that, and that's why this conversation is important, and I'm happy to be here today.
I am Jesus Sanchez. I am editor of El Comercio de Colorado newspaper. Thank you for inviting me to this panel, and then it is a great pleasure to share a conversation with all of you. My work related with the pandemic has been in two areas. One is supporting the great job that organizations like Nine Health Fair or Adelante Community Development have been developing during this time. We have been there supporting your efforts in order to make that the people be conscious about and participate and get vaccinated or get a test. The other dimension of our work has been to create content for people. Content for the people to understand the pandemic and how they need to react or they need to behave related with the pandemic. And then in this area, we have the opportunity of traveling around the state, visiting Hispanic people in all geographical areas of the state. We have the opportunity of talking to them and understand how they live through the pandemic, in order to have some idea or a panoramic of what is happening with that. So it would be great for me to share with you all of these findings, because it's important, and then we insisted that the pandemic haven't finished. We are in the middle of the sea, so we together need to make a work to go to the other side in the better way. But there is a lot of work to do until at this moment.
Ask you to present himself. Pedirle que se presente al profesor Sagaz.
Okay. Professor, please, is it your turn?
Are you talking to me?
Yes, sir.
Is it your turn?
Oh, I'm sorry, I cannot see you. The camera is pointing at the column.
Okay, now is it your turn?
Oh, okay, thank you. Thank you for the invitation. My name is Ernesto Sagaz. I'm professor of ethnic studies at Colorado State University. I'm here in Fort Collins in my office today. With some tech issues here, but we were able to overcome them. I specialize in Latinx politics and Latin American politics, particularly issues of race, migration. I specialize on Latinos in Colorado. So as a social scientist, my job today would be based on these issues.
Just let the conversation kind of direct itself, because there's already some questions that I have for specific panelists, and we're going to start off with something basic. How has your life in your community or your native country changed due to the outbreak of COVID-19? Since we started with the sheriff here, we're going to start with Professor Sagas over there. We're going to start with you.
Well, thank you. So definitely, in the case of the Latinx community, the pandemic upended the community. Latinos, as other communities of color, were the first people to be hit by the pandemic because most of them are frontline workers at the time. The jobs that Latinos normally do put them in contact with other co-workers and with the public. So think, for example, of the service sector occupation, think of construction, and moreover, these jobs that they could not do for home. So they had to show up while the rest of us could comfortably, telecommute from work or video commute from home. In the case of most Latinos, working class Latinos, they have to be there. They have to feed us, they have to build homes, they have to take care of rooms in hospitals and things like that. So they were the first ones to be hit. They were hit very hard, while the rest of us were home, protecting ourselves from each other. Latinos had to engage with the public, so there were some of us getting sick, to get sick really bad before the vaccine was available. And because of the economic downturn, they were also some of the first ones to be hit really hard by the economic downturn caused by the
Thank you for that. So to have everybody answer the question, we won't really be able to get into a really deep conversation about things. So I'm interested to hear how, being on the police force and law enforcement, what did you see going through the pandemic? What impact did it have on the communities, and did you see a market shift in how people carried themselves and how they acted in public and how you dealt with them?
I will say that actually during most of the pandemic, I was working in one of our jails. I was stationed at the county jail at that time. Our sheriff actually did a really good job, and immediately we started to produce masks for some of our inmates. So I do know that, throughout the jail, there were lots of inmates who would say, this is fake, it's not true, they're just, they're trying. And then as it progressed and we were really trying to enforce masks inside of our jails, and anytime you were entering any of our facilities, it was a struggle. Like you were saying that it was a struggle for you, it definitely was a struggle for us, because trying to get some of the items we needed, specifically PPE, was difficult. And so that is why we ended up purchasing sewing machines. And our sheriff said, look, we have to figure out how to overcome this. If we can't get the items in, we will make the items. And I learned a new skill. I learned how to sew. And so it was me and actually several other officers, as well as we had inmates who were interested in working in our sewing program as well. We took a class, and after that we were really busting out about 300 masks every week. So we really did try to overcome a lot of the obstacles that we had, and with our command staff and the leadership that we had, it was great. We really were trying to do our best. So
I appreciate sometimes in difficult situations, people find creative ways to address problems. So it sounds like that's exactly what happened. To build on that a little bit more, and especially in the Latino community, Latinx community, as far as the impact it had on that community, both of you, Ms. Gonzalez and Jose, if you can speak on like what some of those, not only the impact that the COVID had on the communities that you serve, but also what were some of the issues, specifically you, in terms of educating them, sometimes on very complex things like mRNA vaccines and stuff like that. What were some of the issues and even pushback that you got from the community?
When the pandemic started, of course, everybody was trying to figure out if it was real. And then when we started losing family members and losing jobs and opportunities, then we realized how real it is. And I still don't feel that we have seen the total impact that the pandemic has left, because it's still here. We still see people, our Latinos, being in the hospitals, losing jobs, losing lives, and it's still impacted. Some of the major things that we saw at the beginning was the lack of testing for particularly the hours where we Latinos are able to attend to go get tested. The locations were 9 to 5, Monday through Friday, and we Latinos have 2 or 3 jobs to make ends meet. And so that was really hard to identify those places where we can go get tested. And as soon as the employers knew that they had to send their employees to get tested or have them mandate the face covering requirements, it was really a challenge, because it was left to a lot of the businesses to make those decisions, and they were not supported by the local government. And so as a small business making those decisions, you get people that hate your business, because you're putting those mandates to your customers. And they suffered losses because they had people that did not want to comply with the state law or county or whatever at that time, because it kept on changing so many times. It wasn't really regulated by the government per se, but it was more regulated by the business owner and the staff, and there was a lot of pushback. And then losing money from not having enough customers, and then having to pay small businesses having to pay those fees for delivery companies that was needed immediately to get their products, their services delivered, especially restaurants. And so many of the event halls, we do weddings, quinceañeras, baptisms, we do all these different celebrations, and we rent halls, and most of those they had to be closed because we couldn't be in a room, and they had no relief because all of these small businesses did not have the financial preparedness to apply for the grants that were available. The grants came in such a quick moment to apply, and small businesses were not ready, so we had to help them as many as we could, but they didn't have their financials, their taxes, and since people couldn't really get to meet with their tax preparers or accountants, they didn't get those produced immediately, therefore they lacked out in so many funding opportunities, which then means you can't really continue to open the doors and pay employees and qualify for those funds. So a lot of disparities with our small businesses and lots of lack of resources. And yes, there's great organizations that are helping the majority of the businesses, but definitely our Latinos were left behind through this process. And we've learned a lot. Now we're preparing them, we're providing technical assistance. In regards to vaccination, same situation. There was vaccination events happening Monday through Friday, 9 to 5, and we had to make sure that we addressed the issue that we needed them nights and weekends at event halls, at public places, at restaurants, at mobile homes. And one of our most successful areas, the Mile High Flea Market in Commerce City, because people are there every weekend. They go shopping. That is their opportunity to buy their tools and their uniforms and their fresh fruit and just market. And they see thousands of people every weekend that normally would not be able to go to a regular vaccine clinic. And then they didn't have health insurance. So you're informing people to go to a health clinic, or they don't have it. And asking for identification. That was such a big barrier. So many bigger sites were asking for identification, and so that pushes away our community to get vaccinated. And along with that, there are so many other barriers in youth not wanting to get vaccinated, and the parents telling them the importance to get vaccinated, and our youth are getting information, they're doing their own research, and believing in something different. And at the end of the day, the whole family gets hurt by those that didn't get vaccinated or didn't make those impacts that needed to be made. But we continue to learn. We pivoted, like I said, immediately to make sure that we align with those values of our community and provided those resources. But it's not enough. Thinking about just Adelante work, 13,000 vaccination is not enough. It's really not enough. We need to rely on more organizations that can deliver to meet the needs of the community and meet them where they're at. And that takes a lot of trust, it takes a lot of credibility, but it also takes a big team and a lot of funding that we have not, as a small organization, have had, because we are a new organization competing with funds with other established organizations that have done this for years and years, and they themselves had to learn how to pivot this immediately. But there's still more to learn.
In addition to that, I think I want to focus on the critical aspect, or the critical issue related with the Hispanic community in their approach to vaccination. And then, in addition to the logistical aspect, which is equity, and then Maria has been working on that the people need to have access to well-located places for vaccinated in a special schedule of the week. At the beginning of the process, it was not fair, but because of your effort, Nine Fair, Maria, and any other organization, they get some option for the people to have access to vaccinate. In addition to that, when we travel around the state, we identified 3 other aspects. One was religion, the second was political aspect, and then the third aspect was some kind of misinformation about the process of the vaccine. About the religion, most of the Hispanic people are Catholic, and the Catholic Church have some complicated approach to the vaccine. The Pope Francis got the vaccine, but many people, many conservative, extreme right-wing conservative priests were opposing to the vaccine. And then these people provide message in the churches around the state, but here in Colorado, I saw that encouraging the people don't vaccinate. Even trying to diminish the idea of the pandemic. Then it was real. I saw one example in Pueblo, in which there was a huge event for vaccination. It was a FEMA involved there. I spent there 9 hours. During 9 hours, 65% get vaccinated. And then I talked to some people around there. I said, what do you think happened here? They said, no, they go to churches around here, all are Catholic churches, and then the priests say, don't vaccinate. So there was a direct impact. It's not a general. I am telling that I need to be responsible. It's not an official stance of the Catholic Church. It was a position of some priests, more on the radical area, who take this mission of advice against the vaccine. The second aspect was a political aspect. And then if you see today, if you see the map of Colorado, you see that in the center, in the metro area, or the extended metro area, you see most of the, I don't know if it's 80% of the people vaccinated. But if you see the rest of the state, the rural areas, is in the Washington County or Yuma County, there is no more than 35% of vaccination. So we have a gap between the rural and urban areas. So in this case, there is only a factor, it's political factor. All of these unvaccinated people vote Republican, or tend to vote Republican, and in the metro area tend to vote Democrat. And then what is sad that an issue of public health is now a political issue. And then this is there. You can see the figure there. It's a map. And then ISIS makes sense. And what happened with the Hispanic people? We talked to a girl in Cortez. ISIS in the southern.
15 seconds.
Okay, in the west, southern west. And then she said, no, I behave like the general public. If they don't use masks, I didn't use masks. I don't request masks if the other people request masks. Or even I don't vaccinate because the other people, the general people don't vaccinate. So this is a trend. And then she needs to be part of the general group, and then she didn't pay that. And then what is an important point, that people from all of this rural area travel hours from there to go to Maria event to get vaccinated because they want to be identified in their communities that they vaccinate. They move in order to lose a track that they get vaccinated. But these are the factors that I identify.
I appreciate you bringing up some issues, and I'm gonna start with Dr. Ross and Chantel on this one. This is a time of misinformation. Good old internet, there's a lot of misinformation or misunderstandings of the truth. I know Johnson & Johnson, part of their vaccine is created using fetal cells. And then people hear that it is a mRNA vaccine, may not fully understand what mRNA means, or that it involves your genetics, so they automatically assume that's going to permanently change the germline of your family, and your genes are permanently going to be altered by taking the Moderna or the Pfizer vaccine. So what are some of the things that you guys have heard and that you've combated, whether you believe in it or not? What are some of the things that you feel contributed to the misinformation, especially in our community, the Black and brown communities, and how have you been able to kind of advocate against the misinformation and people not just being told what the truth is, but finding out about what the truth is themselves?
Yeah, good question. Lots of misinformation and lots of varying things, but I think it's important to ground that in historical oppression. We have to understand when you have black and brown folks who have been oppressed, taken advantage of, and targeted for many years through a variety of ways, suddenly when there's a pandemic, the trust is supposed to flip on like a light switch. And that doesn't happen. That's not the way trust works, right? And so one of the things that was really important was being able to find individuals who people could trust to have the conversation. So in the black community, one of the people who we leaned on a lot, and I know I leaned on a lot, was Dr. Terry Richardson, who's with the Colorado Black Health Initiative, but a doctor who's been in our community for 30 plus years, who's from here, who grew up in Park Hill, who people can trust and go ask medical questions, and then tapping into other community folks who have platforms to then have these conversations. It was really, really important not to say to vaccinate or not to vaccinate. It was more important to say, here's what's happening, and here's the information so you can make an informed decision. The other piece was really looking at the health of our elders and prioritizing our elders. And so saying, hey, here's the information, right? Here's someone who we can talk to who's local, because you turn on the media, there was a different message every day. You know, mask today, don't mask today. Take the vaccine, don't take the vaccine, right? So for everything that you heard in one direction, you heard something in the other direction. So it was really important to find local people who people could trust to really have these conversations. And it was really important to have people who look like the community, who live in the community, to have those conversations. Otherwise, it could have been the okie doke, right? Like Tuskegee people say, oh, that was so long ago. That wasn't long ago. That was not long ago, right? And when we think about systemic oppression, that wasn't long ago. I mean, I believe our current mayor, Mayor Michael Hancock, went to a segregated school, right? Like, so when we look at these things, some of this stuff we're just 20 years away from. You know, I think about Carlotta Walls Lanier, who lives here, one of the Little Rock Nine, right? She is alive, right? And those are the kinds of things she had to experience. So you can't just place your trust in a system that hasn't always supported you. And so I think that's I think one of the first important things in terms of just being brief. The second part of that is nobody knew what was happening, and nobody knew what it was. You know, yeah, people blaming other countries. Yeah, people, you know, you couldn't figure out how people got it. And so when you couldn't zero in on the what, the how you're supposed to protect yourself was hard to believe. And so a lot of that, I think, also depended on some of our faith leaders as well. And there was a double-edged sword to that. But to really preach about faith, once you have the information, right? Get the information and then have faith that you have more to gain in terms of health than to lose by being vaccinated. But then also creating space, policy, and opportunity for those who were slower to come along or who didn't believe to still feel comfortable and still feel safe by protecting themselves, by wearing a mask, by washing their hands, by doing those other things until they can make a decision based on facts and trust and in our community.
I honestly wouldn't add too much to that. You know? It was very well done. I mean, you're absolutely right. When you have communities, I mean, my responsibility as an elected was just to affirm people, right? To talk about when someone told me I'm nervous about this, I don't trust the healthcare system, to affirm them and to say, I hear you, absolutely. And you have a myriad of historical points that you could pull from as to why you don't trust that system. And the embedded racism in those systems. And so I was really here to affirm, but also to say I'm scared too, right? Like, I was terrified. I didn't know what I was doing as an elected. I was making it up. I'm sorry for all of you who I might have harmed in the process of that. I was just trying to figure it out like everyone. Just saying. Just saying. I was trying to figure it out like everyone. I was making masks. I was buying masks. I was selling masks. You know, I just knew that we needed our people to be protected, and I knew that it needed to come from trusted people in our communities. And I was one of the folks who was hesitant to get my vaccine. It took me a while to get on that train pun intended, to get on that train to get that vaccination. And so I understood from a community perspective where those fears were, right? What the root of those fears were. And I had to do some research around that too. Not to say that when I got my vaccine, I was like, oh, all is great, all is well. I was still a bit nervous. I got really sick, and I was like, so they tricked me, right? But that's how communities are also feeling, is that they, are they telling me all the information? Am I getting all the information? And so, I said I wasn't going to add anything to that, so I'm done.
I appreciate your honesty and candidness on that one. Yes, go ahead, and then I'll move on to the next question.
Touch on a very important issue, and it's the issue of trust. And I want to touch a little bit on the case of the Latinx community, because here we have quite a paradox. In the social sciences, we have something that is called the Latino Paradox. That means that Latino immigrants, by and large, are very healthy. They are young, they come to work, they eat their food from their homeland, and as they become more Americanized, they start encountering health issues. Okay? And particularly to the second generation, they look health-wise like Americans. So there's an extension of this Latino paradox into social issues. If you take, for example, a look at the Mexican-American population, which is Mexico being the largest source of immigrants to the United States and particularly to the state of Colorado, most of these immigrants have very high levels of trust in the state. Mexico had extremely successful vaccination campaigns in the decades following World War II. Mexico's population exploded in the 1960s as a result of those very successful vaccination campaigns. So it's interesting, these are immigrants in their historical memory. They are these very high levels of trust in the state. They remember how grandma had polio, but grandma's children didn't get polio. So they come from countries in which they trust the state when it comes to public health, but as they get into the United States and they start acting more like Americans and consuming American cultural products like American media, then they start behaving more like America. They start losing those high levels of trust that they had in the state. So we have immigrant communities where they are, we're looking at what is going on in Mexico, where the hospitals were chock full, where patients were being turned away, but here in the United States, we're getting a different message that maybe it's not okay to get vaccinated. So here we have quite a paradox, between a population that formerly was very trusting in the state, but as they come to the United States and they hear, what is going on, and they get these mixed messages that all of you have addressed so well, then they start acting more like Americans, that here we have a problem.
Thank you for highlighting that. That's very interesting, and you kind of forget how, if people are familiar with Star Trek, the Borg, how you assimilate to American culture, and you kind of lose some of that.
I have additional comment.
Okay, yes, go ahead, and then I'll move on to the next question.
It's important to identify that. We interviewed last week a physician. He's living in Colorado, but he was visiting Mexico, and then he called me from Mexico City. He told me that according with the current data, Mexico have a little more people vaccinated than in the US. I think it's now close to the 75% of the people vaccinated. The US is no higher than 67%. So today, it is more secure being in Mexico City, where people are using masks, than being in any street in the United States. Wow. This is sad. And then because we are vaccine available here in any place, this is not happening in Mexico. But in Mexico, they are more conscious about the people about vaccinating and following the health protocols.
I think that perfectly talks about the paradox that Mr. Sagas was just talking about. I want to move on to talking about risk. I think we all kind of have real risk, and then there's a level of fabricated risk along the way. I remember being in the grocery store. I was the only person that left the house during the beginning of it all, just to mitigate chances. And I happened to sneeze in the grocery store, and the whole place just came to a complete freeze, and everybody looked at me like I had the plague. And I think some of that was the fear that Chantel talked about. We're just trying to figure it out. So as we're moving on through not only the last 2 years, whether it's consciously or subconsciously, have we been thinking about how likely we are to get COVID and how likely we are to get really sick from it, especially as people get vaccinated and the news reports like, hey, 95 or 98% of the people in the intensive care are non-vaccinated people struggling with ventilators. How are we considering these when we're making our risk assessments, especially with, we never know when the next variant is going to be really, really tricky. Is that going to impact your decisions going forward and how you communicate to other people about the importance of taking care of yourself, whether that's boosters and things like that, and how do you identify that risk and explain it to other folks, especially people of color?
I'll talk about this from the context of our operators and our customers. So there were a few things that were true during the pandemic and still are true, is that we had operators who were frontline, and that the folks who were using our services were typically folks who were also on the front line, who were commuting to their jobs or to healthcare appointments, et cetera, et cetera. And we also knew that the average age of our light rail folks was 47, and the average for our bus operators was 52. And so the early information was like, the older you are, the more likely you are to get COVID and to meet your demise. And so that was scary for me, right? As someone who is over policy of a regional transportation system where we need to keep people safe while also understanding that people still needed to work because they were on the front lines, but we needed to keep our operators safe as well because they too were on the front lines. And so it was just a matter of fact. It wasn't necessarily that I was telling our operators that, hey, you all need to get vaccinated, but it was more of, hey, as a directive to our general manager, can we offer vaccine clinic sites at our bus terminals where our operators currently are? And to your point around not having those hours, that 9 to 5, that our operators didn't have the luxury to be able to meet those hours. And then the same for our frontline folks who are utilizing our services. Can we go to bus stops and have folks be able to get vaccines at bus stops because that's where they currently are. And so it was just a matter of fact for me to be able to say, I don't know what all of this is, and the regulation and the directives are changing constantly, but as they are changing, let's make sure that whatever we do, we're taking it to where the people are, where the people are gathered, and we give them the information and the autonomy to make whatever decision that they believe to be best for themselves and for their families. And that will continue to be my approach, to offer the resources, and people can do what they want with those resources, and I'm happy to be around or to have Dr. Richardson, right, someone who they trust, to answer the questions that they need so that they can move forward. We stopped collecting fares at some point where we saw with our unions across the nation, where we saw operators who were actually meeting their demise. And so we had to take that into account. And so there was quite a fight at the beginning of the pandemic. We had to make sure that our operators felt safe. And they were calling me on my personal cell phone at all hours of the night and saying, Director Lewis, I am terrified. We are all absolutely terrified. Do whatever you need to do to make sure that you're keeping us safe. And so that is my commitment, and that is my obligation to make sure that whatever phase of this pandemic, as we continue to journey through it, that the folks who are in my care, that I am taking care of them, and that we aren't losing operators and we aren't losing customers because we didn't do all that we could to protect them.
One of the things that we've realized through this phase is that we have to be transparent. In order for us to continue to have that trust with the community, we have to tell them what we know. Even if it's not 100% of the information, we don't know everything complete, and model that. We aligned with, we did so many interviews with Patricia Galeto at the Latino Research Policy Center, with Virginia, with Jesus, we talked with so many different doctors, is talking about this is real, these are the side effects, this is what's going on, and just listening to stories of the community where there's doubt, and we were very transparent, informing the community, and that's how we want to continue to provide that engagement opportunity, and again, meeting them where they're at, making sure that we listen, that we empathize, and that we say, together we're gonna be part of the solution, because we're not over, and we continue to learn, but we need to embrace that every single moment. We cannot lie about it, we cannot hide information, we cannot deny them the services that they need, and we need to hold ourselves accountable. And if we say, go get vaccinated, guess what? I'm gonna put my arm to get vaccinated. If it's the first, the second, the whatever number, because they're looking at us as those role models. And the moment that we stop saying, this is good for me, this is good for my community, then guess what? They're gonna stop as well. So we cannot stop making sure that we listen to them and that we provide them that trusted environment where they are able to fulfill those needs that they have as a community.
I'll just add to that. One of the things that we really have to think about was our values, right? And so purpose over profit, right? When you think about an education system, our profit comes from enrollment and things like that. But we had to say, what's our purpose right now? And our purpose is the safety of our students. And so a lot of our students in community college are essential workers. They work in jobs where they don't have the luxury to stay at home or have paid sick leave, things like that. And so we have to look at what are some of the challenges that are causing our students to go out. Some of that was food, right? And so we had to look at food programs, where we were looking at food delivery, right? We were looking at how do we make sure that outside of the classroom or outside of their home, our students could be safe. And that came also at a large expense, right? So we were now using a lot of resources to buy food, to buy different levels of bus passes, different things like that, and it was really different depending on the college and the environment, right? Some of the things that we were experiencing in the metro area were different in the rural area, right? And so we have to look at those things very carefully and ask ourselves, a simple question: how is the pandemic stopping people from thriving, and then what do we do about that, right? And then we have to put together teams to do that, and the most important part of that was all of our presidents, the CEOs of all our institutions meeting weekly to talk about these things, because everything shifted fast, and so we had to be able to shift just as fast. The other thing that I'll say in terms of risk is comprehensive resources, right? We had to look at the intangible things that were being caused, right? Mental health, depression, anxiety, right? These were things that people weren't looking at, but these were really big impactors of the pandemic. And so if you're depressed or you're full of anxiety, probably not gonna log in to learn, right? If you're too depressed, if you have to literally choose between going to work to feed your family or not, what does that do to the psyche of the whole family, right? And so we had to look at some of those things. So increasing access to virtual counseling, both for students, faculty, and staff, right? Because that was another part of the conversation that was a huge risk that people forgot about or just didn't think about, and was creating huge challenges and other potentially fatal consequences for folks.
Did anybody else want to comment on that?
One comment about risk is that in our mission as a media, we need to provide the correct information and the fair information and in-depth information for the people to understand the situation. So we learned that in this case, in this situation, we need to go to science. And then the main sources are the scientists, the physician. And we try to develop relationship with people who speak Spanish, and then we got some extraordinary scientific here in the community who can communicate a message in Spanish to the people for trusting them. So to avoid any kind of misinformation or any kind of no valid information. So this was part of there, and then using these sources, also we learn about the idea of flexibility, because in this case, the science change. And then sometime when you make some research related with the first 6 months of the pandemic, maybe this information change for the next 6 months. And then you need to understand that and communicate to the people. Sometimes they say the people, okay, why? They say don't use mask, and then they say now you need to use mask. And then the idea is that in the future you need to think that maybe you will be asked to use mask again. And there is no problem with that because this is the science. So I think this is our vision about risk during the pandemic.
Thank you for that. Thank you for that. So,
If I may,
yes.
I would like to follow up on that. I think that the issue that you mentioned about transparency is very important, particularly in the first months of the pandemic. There was so much that we didn't know that science was trying to figure out. So sometimes it's okay to say, I don't know. And I remember during those first weeks of the pandemic, people dressed like astronauts to go to the supermarket. All the gloves that we went through, double masking, avoiding people like the plague being hesitant to touch surfaces, cleaning products or bringing them into the house, and all that just went out the window because that's the nature of science. Science evolves. It goes through trial and error, experiments. So I think that sometimes people are looking for a silver bullet, and there's no such a thing as a silver bullet with a pandemic that is evolving. Our most recent experience, our most recent tangible experience with a pandemic of this magnitude took place 100 years ago. So there's no living memory of that. So I think that when it comes to transparency, I think that sometimes it's important, even though it may not be the message that people may want to hear, to say, we don't know, but we're still trying to figure that out.
And speaking of 100 years ago, there are very few people that are alive today that lived through the Spanish flu. That was just as bad, if not worse, because of the lack of technology and healthcare that was available at that time. So it's important that people understand and know your history or you're doomed to repeat it. I talk about that quite a bit. One of the things that COVID kind of highlighted issues, me personally, I think a lot of these issues existed. Like, for example, as a teacher, I knew the gaps that existed in learning well before COVID happened. And COVID happened, and then other people who are have more access to power and influence saw their kids also getting those gaps, and then it becomes an issue. And that's also the situation I feel in healthcare. Some of those gaps in healthcare, I spoke about Tuskegee syphilis experiment. I talked about the studies that they did that pretty much established the OBGYN field by studying on black women slaves a long time ago. If you read the book Medical Apartheid, it talks about all these issues that exist in the black community specifically, but also in the brown community as well. So how can we, I know Morehouse School of Medicine, for example, is a predominantly black institution that prepares doctors and nurse practitioners and things like that, and Meharry Medical and a lot of our Hispanic serving institutions. How can we, one, get access to more representation in the medical field, and two, how can we make sure that cities effectively integrate public health considerations for communities of color to make sure that in the future we can adequately serve them and be prepared for hopefully not for a long time the next time this happens.
So in Spanish, there's a word that I use very often with all the power, and the word is ganas. Ganas means the willpower. I believe that if anybody wants to make sure that there's equity and health and economic prosperity and all these things that we value, you have to have ganas. You have to have that willpower.
Amen.
If you don't have, it doesn't matter at what level of leadership you are. You could be a student, you could be an elected official, you could be anybody. If you don't have that burning desire to make sure that your neighbor has the same benefits as you, the same opportunities as you, then it doesn't matter. It really does not matter. It comes to the point of you, within you. If you see the disparity, make a change. Who do you have to call? What do you have to do? It starts with you. You being part of that. And we've heard this through, our life span. We heard this. Be the change, right? You have to be that person that makes the phone call, that opens the doors, that brings the opportunities, that if you see an injustice, you raise that opportunity. Because if you are watching that and if you're not making sense of making that difference, there's a possibility nobody else is going to see it the same way, or that experience is not going to happen, and we'll continue to leave people behind. So unless each one of us that have experienced these inequities, that we've been in leadership positions and we don't raise that voice of those individuals that we continue to be leaving behind, there's not going to be a change. And we can talk really beautiful at a city council, with elected officials, and we're going to do this and we're going to fund this. Does that really go all the way to the grassroots of the issue? And how many more years or pandemics is it going to take for us to really make that difference? Like, when I have some of these meetings with funders and elected officials, I tell them, if in my lifetime, the worst time living a pandemic and trying to make a difference, if founders, organizations, leaders do not come together now to really look at the grassroots problems and make that change that needs to happen now, I'm not going to see them in my lifetime to make that change. It's just not going to happen. So if it took this pandemic to bring awareness and to have that decision to make that change that has to happen, that it's been for generations now, it's now. The opportunity is now. Look at your environment. What is that is called for you as a purpose? Make it now. Don't wait for somebody. It's your opportunity, it's your responsibility, and we should all be accountable for that.
I'll just quickly say we have to depoliticize public safety and health. We have to humanize it and then prioritize it. This isn't rocket science. We just have to care about people. And I truly believe that there's a leadership deficit in our country right now, and so we have to operationalize our leadership. And I don't mean that with the elected officials. I mean leadership with everyone. We have to operationalize it in a way that allows us to tell the truth about our experiences, look at what's wrong, and put these brilliant people, because there's so many brilliant people in our country together, and let them problem solve.
One of the things that I wanted to mention is that I think that it is important that we realize, as you were saying, this is not something that started just during this pandemic. When you look back through history, Black and brown people have been the demographic that does not go and get vaccinated. And not just with this vaccination, right? We're talking about even the flu vaccine, and there's lots of different vaccines that we have lower numbers in. And so I'm happy that this brought awareness, but it's not new. And I think that we are having this conversation so that there are people who need to realize that we need people who look like us, who are going to be the scientists, who are going to be the doctors, because those are the people that we are going to trust, right? When you are talking to someone who looks like you are more willing to go, okay, you know what, I might get that, because she's saying it's okay. If none of the people involved in this situation look like you are more likely to be hesitant and go, I think they might be trying to pull something over on me. And so I think that is extremely important that we recognize that. Now, what that may look like could be funding to make sure that people who are interested in being doctors, whether they be women, minorities, have that opportunity to go to school and get what they need to move forward in the careers that will give them that visibility to the other communities who are more willing to listen to them. So I think that that's important, because I believe that right now we are going, oh my gosh, Black people didn't go get the vaccine. When really, you can look throughout history and that's been a common trend. So it's important to recognize that.
Did anybody else have comments on this topic?
Just one, make college free, right? Reparations comes in many forms. Let's make education free. Simple. Listen.
Mexico just did.
Yeah. They literally did. We often have this conversation from a resource standpoint, but we definitely should be talking about the humans, right, and the decisions that we are making. And we tend to find the money when we need the money, right? But we don't have any money when we actually do have some money, right? Anywho, that's another conversation. Every day I wake up with the audacity. And I tell folks this, I used to tell my students that to have the audacity to believe in and to create a world in which we are prioritizing humans, right? In a world where we aren't focusing on the economics, where we aren't focusing on how much money we're able to garner for ourselves or to garner for our businesses, but we are truly taking care of people. And so have the audacity to be bold, to be brilliant, to go into spaces and knowing that your advocacy may lose social capital, political capital, financial capital even, and be willing to lose that to gain whatever it is that we need to for the humans in our countries, in our universe, and in this world. Because I think that's not happening enough, that people just show up and to have the audacity to know as a visionary and to see a different world and to be a part of that change. And not waiting for other folks to do it for you. Like to know that you can do it and you don't need permission from anyone, you don't need a pink slip, you don't need anything. You just need to show up and do it. So have the audacity.
No, it is clear that during the pandemic, the disparities worsened. But one, in addition to leadership, to fund, to create a program, it's important to emphasize prevention. So because of that, we are pleased to support the Health Fair program and Adelante community program because it's an important aspect to produce a change, immediate change, in the sense that educate people and make them conscious about the problem that they are facing. And then they can do a decision today and change their life for years. So this is another important prevention, work on prevention.
Anybody else?
Yes, if I may, thank you. I would like to add that I think that one of the big challenges is political science, people's agency, the people's capacity to act independently. I always tell my white colleagues that a can of oil is dropped on the river, an email is sent, and within 24 hours, 10,000 people are complaining about it, and the city and the county will come and do something. It just doesn't work like that, with vulnerable communities, with historically oppressed and underrepresented communities. So essentially what we need to do is to build the community's capacity to build agency. And unfortunately, this is something that got sidetracked as a result of the pandemic. People are locked up in their homes, they're scattered, they're afraid. So if anything, in terms of fostering agency among our communities, this was a major setback that we still are trying to recover.
I agree.
I have friends that talk about crab in the barrel syndrome sometimes and how leadership, especially in black and brown communities, can kind of cannibalize themselves because everybody wants to be the first to do something. Everybody wants to be the leader. And nobody wants to, I talk about synergy with my students all the time, like the whole is greater than each individual part. What can we do in our communities? I'm kind of going away from the list right now. What can we do in our communities to kind of overcome that and operationalize leadership and provide agency to our communities to, regardless of access to resources and money and power, how can we mobilize our human capital to make sure that our communities are being served adequately?
So, yeah, I'll jump in here. So I think there's a couple of things. And one of the first things is we didn't get here by ourselves, right? And so we have to recognize that this is a collective and it takes everyone, right? And so we have to treat marginalized communities, communities of color, like we treat white communities. We just have to. I've had a conversation where, you know, we talked about, imagine if COVID only affected communities of color, would we be having these kinds of conversations? And most people say that the answer is no, and I agree, the answer would be no. And so that, again, back to that human side. And so we have to, in everything that has something to do with community, we have to have this concept of nothing about us without us, right? Everybody needs to be at the table where we're talking about boards, commissions, boardrooms. We have to have the diversity of thought and the lived experiences of a variety of people in order to touch the challenges and opportunities and strategies for everyone. You can't have a whole community thrive if only part of the community is having the conversation. So I think that's the first thing, and I would add the second thing is, you know, I know this is a capitalistic society, I know money matters to people, but the reality is sometimes we have to just put people first. The money will take care of itself, it always does, right? If we put people first and begin to, just like we did with COVID, right? We found out we could do tremendous things very quickly as a community when we came together. If we took that same attitude and that same approach to everything that we're having challenges with in our community, it would be such a better place. And we have the opportunity to do it. We know that it works. We know that people can come together. We know that when we come together, the outcomes are better. So why not duplicate that strategy in everything we do? Again, not rocket science. It's literally understanding the narrative and shared experiences and lived experiences of everyone in our community. And that all that takes is time. I don't even think it takes as many resources as people would think. It's a lot more about respect and integrity and an opportunity to understand and hear people so we can actually problem solve.
Added to that, I think there's a lot of egos. People that have been in leadership positions for a long time, they want to be the first ones again, they want to be the only ones again, and the door needs to be wide open. There's new leadership coming to Colorado, to all of our communities, and we need that opportunity to lead. And when egos are in the way with organizations or leaders that have been established for so long, it's time to have these individuals embrace the new leadership and welcome with open arms and say, here's the baton. There's opportunities for you to expand what we've established, what we've done. But there's still a lot, especially in the Latino community, you mentioned, we pull each other, for the dollar, for the same dollar. And if we were to able to work together to really be mission-driven organizations, to have those values and to align that at the end of the day, all of our contributions are going to make our community better, I'm able to go to sleep and dream of beautiful things that we all could accomplish. But instead, pushing organizations down or pointing fingers that you did or you did not do or you had and you didn't do, that doesn't work. It's time to bring that collaboration, and it's time to teach the new leadership what needs to be learned and open those doors of opportunity. We are hungry right now for that opportunity to lead, but systematically, the same organizations continue to take over and not necessarily deliver in the way that it needs to be delivered. So, time for change.
I think we've been socialized to think that leadership is attached to position, or attached to power, or attached to a certain status in this world and in our communities. And my request would be to deconstruct our thinking around who the leaders are in our communities, and not to ascribe what we've been told and how we've been socialized to believe leadership is. I think there are leaders throughout the community, and especially, particularly in Black and Brown communities, who don't necessarily have the resources or have the capacity or don't even think of themselves as leaders because of how we define leadership and those that lead in our communities. You know, from elected leadership to folks who lead from the executive C-suite positions, lead from positions of power. I think that we really need to focus on how are we teaching our youth, teaching our young folks that leadership isn't about position and you are actually a leader, right? And leadership is not always leading from the front, right? Sometimes leadership is leading from the side, sometimes it's leading from the back, right? Sometimes it's guiding, sometimes it's mentorship. And so to really begin to deconstruct and reconstruct how we define leadership and to not be afraid to reject how society defines leadership or how society has historically defined leadership and to redefine that for ourselves.
Does anybody else want to touch on that question?
One short comment. I think it's important to keep the conversation, this kind of conversation, but also based on that, it will be important that some organization, I don't know if National have this in mind or any other organization or even the CDCs to produce a clear picture of how the pandemic affect in general the public health and identify areas to focus on or for working in the future. It is mental health, it is pre-existing condition like heart disease or diabetes or I don't know. Identify specific areas to focus the work on that and keep the conversation because I think this is the beginning to have a clear idea of where we need to go.
Does anybody else want to comment there? All right, so how can I work this? So there is an article that Vonzel just recently showed me, and it can be confusing to navigate, like FDA approval and the European Union version of FDA approval. And then there's one out of China, I believe. There's only 3 approval bodies in the country, I do believe, if I remember correctly. Sometimes understanding what non-clinicals are with phase 1, phase 2, phase 3, phase 4, and continuing post-marketing and all of that can be confusing to some in understanding what it takes to get a vaccine approval and understanding, for example, mRNA and how the technology behind it has been being researched and studied for 15 years, and then it just would take a little portion of the genetics of it for the vaccine to work. With legislation that says we can't go back and sue Pfizer, Moderna, if things go wrong later on down the line, if they find something there, what role do you think that plays in our communities in terms of not necessarily understanding the science behind it, but then you hearing, oh, we can't, if something happens to me, I can't sue. That is especially heightened in the Black and brown communities. What can we do to kind of ease those concerns and also prepare ourselves, because to be honest with you, the Black and brown community would probably be most impacted by it and the recourse from it. So what can we do to, one, overcome those concerns, but also protect ourselves as a whole in the worst case scenario?
So I'll quickly say, I don't think that's an issue in the community. I don't think people are thinking about it on that level. And I mean, and when you think about even the way you answered or asked that question, you've either got to be intimately connected to it or an academic or something to understand it. And so I think that's an example of, the KISS method. Keep it simple, stupid. And I hate to use that word, but we have to be able to explain things and provide data in a way that people can retain it, understand it, and use it. Everybody doesn't have a PhD where they sat through a year of research methods, right? Like, I did that, but my brother didn't, and my neighbor didn't, and a lot of people in the community didn't. And so we have to give people information in the way that they can receive it, and then provide accountability measures that people can understand. Again, it's just not rocket science, It's as easy as a red light, right? When you get to a red light, red means stop, yellow means slow down, green means go. We have to give people data in the same way. This is how you operationalize the data. This is how you use it. Here's who's accountable, and here's why they're accountable around this data, around this decision. We just have to make it simple. I don't think that people are worried about survival. They're not thinking about lawsuits. You know, people are thinking about oppression and what things have happened in the past, right? Nobody's, at least from the Black community, and I don't mean to generalize, but if we were worried about lawsuits, reparations would have been done already, right? Like, so those things don't work. We're worried about, you know, how we're going to live, can we live, did the vaccine work, will it work, is it 20 years from now, is my hair gonna fall off if I take the vaccine now, right? And that's why we've got to be able to give transparent, honest, and open conversation and data around it. And we have to be honest. Hey, we know that right now, this is what works, and this is what's gonna keep people safe, and we're gonna keep you updated. People will appreciate the truth rather than smoke and mirrors. And so we just gotta give people the truth.
And also, in addition to that, this is great. I was looking in my phone, a term. Maybe the doctor can help me. Is it the genomic policy, or when they are searching the new variant of COVID? What is the term? Genomic?
Genomic variant.
Yes, but what is the search? Is the authorities in the world are looking for new variants? They are doing genomic sequencing. Okay, but I said that because of that, to keep the thing simple. So if we go to explain to people that in the world, all government of the world are doing that at this moment, and even in the local level, all authorities in the health department are tracking new variants, and then if they identify one, they communicate to all people, hey, we have new variant, and then maybe, I think that at this moment there are around 3,000 variants in the world, but it's so sophisticated to communicate this to people. They say to say, what is important is the pandemic haven't finished. You need to be protected. If you feel that you have some risk, you need to have the mask in your pocket and put this on. That's simple. And if the authorities ask you to make some additional protocol, follow that. But I put this example because in the war, this is not a situation finished, but there are some action, serious action in the war to avoid some kind of crisis like that. We were surprised at the beginning of 2020, but this is keeping the things simple.
Yeah, we need I'm just a Bill version of COVID.
To touch on that, I think that in the essence of keeping it simple, like you were saying, sometimes you have to meet people where they're at, right? And so sometimes you have to talk about the things that are important to them, such as like in the Black community, family, right? Family is very important to us. So sometimes it's not always about you. It could be a conversation about making sure that you're keeping grandma safe. It's important that you are going to keep your children safe. I know for me, my husband and I both work in this field. And so we come in contact with a lot of people, and sometimes a lot of people who are not taking the best care of themselves. For us, it was very important to get vaccinated because I have a 2-year-old son at home who cannot be vaccinated. And so it was very important for me and my husband to make sure that we are not bringing anything home to our kids. My parents are getting older in age. For me, it was very important to make sure that I am not bringing anything to my parents. My husband's grandmother is still alive, you know, so there were things like that that were important to us, and sometimes making sure you're having those types of conversations, because when you start talking about the variants and all these things, that's not what's important to certain communities, right? So I think that it's important to make sure that you are meeting people where they're at and you're having those types of conversations to get the point across. The other thing also is to make sure that the right person is having those conversations. And I know, like for us, there are people who you trust and there are people who you do not trust, right? I know that in the Black community, a lot of times we do go to church because we are going to trust what the pastor says, right? So when you talked earlier about pastors saying, about priests saying, don't get vaccinated, those are the people that community trusts. And so it's important that the people who need to have that conversation are sitting at the table with them and making sure that they are constructing the correct message to make sure they're putting out to their communities, because that is who's going to pass on that trusted message where people are going to decide, okay, you're right. That is something that's important to me, and I'm going to go get vaccinated because the pastor said that it's important to do that. Or I'm going to go get vaccinated because you're right, it's not about me, it's about my family and keeping others safe. So I think that that's important as well.
Does anybody else put that?
So we live in an information era like we have never seen before in humankind, and that raises two major challenges. I had a colleague some years ago that he was teaching a class, and a student raised his hand very confidently and said, "Professor, according to the internet." So on one hand, we have the democratization of information. Anyone can post anything and anyone can read it, okay? Which has been a major advantage over civilization, but also comes with certain challenges about how we separate, what is right from what is obviously plainly wrong in some cases. And then the other challenge is what I read a very prescient book just before the pandemic hit, and it's called The End of Expertise. Because of the democratization of information, there are no more experts. Anyone can go up and challenge the doctor. No, doctor, I think that you're wrong. That might get exactly what if I get the vaccine. So, and oftentimes this end of expertise is not only because of the democratization of information, but also the failure by experts and elected leaders to communicate, as the panelists have said, complex data in a simple form. We don't have to read the studies in the New England Journal of Medicine. We just have to be able to trust the experts. And so how do those experts and our elected leaders, our community leaders generate that trust that we don't have to question that, and we don't have to look in alternative sources of information for someone to read, and digest that information even without any degree of expertise. So I think that the challenge in our era is how do we cope with the information overload that we're experiencing right now, with all the disinformation that is out there. The right information is there for those who want it, but it's lost in all this noise that we're facing right now.
Very few people understand what a peer-reviewed article is, and how there's a difference between PubMed and Google search, and op-ed versus peer-reviewed research paper. And if you ever try to read a peer-reviewed paper around genetics, you start talking about genetic sequencing and so I get excited. But it's hard. Some people would have to Google every 5 words, what does this mean? What does this mean?
Or the difference between the Lancet and Wikipedia.
Exactly. So the amount of misinformation and opinions are there.
We should be able to trust the experts.
Exactly.
Not read them.
But unfortunately, the opposite end of that is that everybody thinks they're an expert anyway, just because they have a Wix post website and things like that. So it's important for us to make sure that information that's going out there is the correct information, and be mindful of the people that we're listening to. And internet, the bad side of it, it's also a good side because it allowed thousands of scientists around the world to share information. And when you're sequencing genomes, whether that's human genomes or COVID genomes, that information gets shared, and you have a lot of trained eyes to look at it and make conclusions that are helping us out along the way. So my last question for everybody as we start to wrap this up, we were all shocked and appalled when COVID first happened, just trying to figure things out. Now that we've gone through it, it's been a couple of years now, what would we do differently, or what would we hope for the government to do differently and leadership to do differently if we're in the same situation in the future.
Make a decision and respond immediately.
You know, I'm inspired by the resiliency that our Latinos have. And, you know, responding early and fast is important, but meeting them where they're at. Like, I would not change that at all, because it's a big sacrifice for many people to know that they need us at the church, they need us at the flea market, they need us at the mobile homes, they need us at the small businesses, they need us at a dance place. But the one thing that I would change is to immediately make people accountable. Because I felt like for a few months, I was just eating that myself, like, somebody should do this, somebody should do that. And then I'm like, no, I'm seeing it, I'm gonna do it, and that is why I'm so inspired by the optimistic of our Latinos. Like, they know how hard they've been hit, but guess what? They still get up. You still go see them, you know, they're working at the restaurant, they're working in construction. Construction does not stop. We still have food at our tables, and they are the hardest working individuals that you will see, regardless of the pandemic, regardless if they lost someone, regardless if they know that they're not going to be able to pay their bills on time. But that resiliency, I would not change. I'm inspired, and I hope that you're all inspired by all of the people that continue to make a difference and show up, even though there's many people that have not shown up and delivered the way that they should have.
You know, I would say that I would agree. I think meeting people where they're at is extremely important. I know in our field, we are working 24 hours a day, 7 days a week. What we do does not stop. And so making sure that you are meeting those people where they're at, whether it be coming to jails, whether it be coming to stations, or, you know, just making sure that everyone has access to the things that they need. I think the other thing that is important is educating people, you know, right? Like, I think that making sure that the message is out there and it's getting out there to everyone correctly is extremely important. And I think that because of the internet, we have so much false news that is happening on a regular basis. And we have to remember that we are dealing with a generation that is where they're getting their news. It's not like our parents that are sitting at home and they're watching the news every single night at 10 o'clock, you know. The majority of this generation's news is coming from social media. And so making sure that people are being held accountable, whether it be Facebook, Twitter, or whatever, making sure that if there is false news on there, it's being taken down immediately. You know, those are things that are important, and that's something that I think that I would change, is making sure that we are holding those types of people accountable, because really it's about the ownership of those social media sites that's going to let that information get out there.
I think this is a crime to have became the pandemic in a political issue. To put this in the politics speech, in the politics debate, this is a crime. Because at this moment in America, there is 130 million people with no vaccine. This is terrible situation. There are conditions in America for a biggest variant that will be dangerous than the previous one, because it's huge. It's 130 million people with no vaccine. Then we can say, oh no, this is 200 million have been vaccinated. Yes, this is true. But what happened was the people who haven't vaccinated? This is a big problem. And then this is the wrong handle of the pandemic in the U.S.
I'm going to say, as a political scientist, looking back at the beginning of the pandemic, if we could turn back that clock and have done something different, I wish we had elected a different administration. The failure in leadership came all the way from the top, from the White House itself. Not only the inaction of the White House, but the disinformation wasted valuable
Thank you. Do we have any questions from the audience? I know we have a few people in-house, and if there's any online as well. Do we have any questions out there?
Questions, okay.
Okay, go ahead.
So how do the vaccine providers reach out to the community and access the community leaders and the community? Because we're gonna make it happen. We're on board with you.
So repeat that, please.
So how can we work with you as a vaccine provider to provide vaccines to your community at those off hours with the communication? We're ready to roll. How do we now work with you in partnership to make that happen?
So I would just say, again, tapping into who the influencers are, who the people who have access to people, that I think that's important. I think conversations and involving conversations with youth about the vaccination and helping the youth see the value of it. Because when youth see the value of things, things happen. When you think about every major movement in our country, it was young people who did that, right? And it's not talking at them, it's talking to and with them around why this is important. And then I think the other piece is it's been said up here, we have to figure out now how to move the conversation to health and safety and away from politics. That's the most harmful thing to the pandemic, is making it political. Because once it's political, people aren't thinking about their health, they're thinking about choosing a side, they're thinking about trust, they're thinking about misinformation, they're not thinking about this is going to harm the inside of my body, or this is going to harm my family. And so we have to, focus on the medicine, on the science, being out in the community, and definitely staying away from bankers' hours. So where do people go, right? Yesterday was opening day. It would have been nice. I mean, I've seen a couple, but there should have been vaccine buses or things everywhere around opening day. Sports events. Denver Center for Performing Arts, right? Like, where people go is where these things need to be, because, out of sight is out of mind, in sight is in mind, right? And so we want to be as visible as possible, stay away from politics, and focus on the benefits of the benefits of what the vaccine does for folks.
I think for us, we've been building our partnership. You being empathetic with our community, really coming and seeing, like, how do we work? What do we talk to the people that come to us? How do we listen to them? How do we embrace them? We hug them, we welcome, we give them food. We bring cultural opportunities. We brought the mariachis, we brought the Aztec dancers, we brought folkloric dancers, bringing ethnic food, and really, like, having you come to our world of understanding, this is who we are. And if you are willing to work with us the way that we are, the way that we practice our trust with the community, at the end of the day, it's going to be a win-win. But if you are coming in with your expectation and your checklist, we got to do this and that, and then forget about the community, there's no relationship. There's no opportunity to really deliver on the purpose that we want to work together. So I think that flexibility, that understanding, that being empathetic, but also bringing more staff that looks like the community that we serve. And that's across the board, in every industry, every opportunity. We need to continue to see people that work with us, that look like us, that speak like us, and that builds that trust. And I understand that, we're in a very difficult time hiring bilingual or individuals that are qualified to do different jobs that we need. But guess what? That's another opportunity of bringing people, going through training, opening the doors, maybe not having so many educational requirements, but more of community outreach, because sometimes those skills are not easy to teach. Sometimes, we're born with some of these natural helper skills that are embraced because of who we are and because of our mission and of being servant leaders. But it does take time to build relationships, and something so small could break those relationships, and that work could stop. And so it's important to always analyze and see, like, what can we continue to do in every direction, because we all have the opportunity to learn from each other and really embrace and what is available to make sure that we deliver to our community. So thank you for asking.
I just want to chime in on this only because I do think that it's important to realize that, like one of the other panelists said, a leader is not necessarily a person who has that title, right? So I know, like, when I was growing up, Reverend Kelly was a big, he was very inspirational. I went to Columbine Elementary, and he'd be out there on the playgrounds with us, and I mean, he could have told us to do anything, and we were like, okay, he said to do it, let's do it, and throughout my life, whenever I see him, I always make sure to go say hi, hey, so I think that it's important to make sure that you're in that community, or you know someone in that community that is able to tell you who the people that are trusted, who the people who are the leaders, because it may not necessarily be the person with the title. So I think that that is extremely important. As you were talking about hiring, we're hiring. Please come see me. So I'm the recruiter for our department, but one thing that I can definitely say is that even for me, I was a little hesitant in getting the vaccine. And at one point, it was, we've done a lot of stuff with Hope Communities in our department. They come in and they help teach a lot of our inmates how to do resumes and how to do lots of different things so that when they leave better than when they came to us. And one day when they were there, she said, hey, you know what, we're doing a 9 health vaccine clinic. And I was like, I can't go to one of those. It's at night. I was like, what? At night? Okay, I can come. So, it's really important about just making sure you're building those relationships. And I ended up going to one of the 9 health clinics to get vaccinated. And just from another person I was working with told me. So, yeah.
I so that keep the effort that you are making and trust in on the local leadership and choose the correct people, because when you identify leadership, you need to know where you want to go. And then in the case of Adelante, we also are partner of them. We identify people who are committed with this, and then we know as a media that we will go far with them in the sense that they are there, they are a serious person, and then they multiply all impact that you want to have.
As he tries to get everybody back in and get Professor Sagas into the Zoom. As a teacher, one of the things that I've noticed is that even being in school is one place where you can definitely tap into the community. Being present at the school, whether that's teaching students about everything that's happening, and then you be able to be there after school hours and tap into the families that are there. That's the easiest way to reach communities that you may not understand how to get to if you don't know who the leaders are in those communities. So as we wrap up, I want to thank Dr. Ross. I want to thank Sergeant Stephanie Lang, Maria Gonzalez, Chantel Lewis, who had to step away for another engagement. Jesus Sanchez, I appreciate you being here as well. Professor Saga, as you get that situated, hopefully you can join us one more time. I want to thank you guys for giving your perspective. I've learned a lot from everybody here today. My last parting words is that meet people where they're at. I think that was a resounding thing today. Meet people where they're at. We're all human. We have more in common than what separates us. And we can't be scared to approach things that are new and novel and maybe stepping outside of our comfort zone. That's the only way that we can overcome some of the things that we're dealing with and be more equitable, whether that's in healthcare, whether that's in education, vaccines, and things like that. I really appreciate you, Jesus, for talking about being prevention more so than reaction. The best way, especially in the Black and brown community, is to be proactive in how we're taking care of our health. That way, when we do get sick, it's easier to take care of. There's too many family members that are up there in age that have a regimen of medicines that they have to take because they weren't proactive in their health care. And one thing that you said, Maria, at the beginning is that you had to request things to be helped. And when we're in things like the pandemic, we shouldn't have to request help. We shouldn't have to request things that should be given to people. If America is really about the people, the 14th Amendment guarantees that everybody is equal under the law, then we shouldn't have to request, we should expect. And if we can all fight towards pushing our leaders, pushing the power dynamics to provide instead of expect us to ask for, I think we can be better off, whether it's a pandemic, whether it's education, whether it's anything that we're dealing with. So I appreciate all the panelists coming here today. I appreciate everybody that was in person. And I look forward to working with you all and making sure that we continue, and despite it doesn't end as we start to come out of the pandemic, it doesn't end. Go ahead.
This is a wonderful conversation. So how will the community hear this conversation? Because you're saying what they want to say, but do not have the platform to say it. How is this going to continue to be a conversation? Because it will be said here, you walk out the door and it's gone.
It is available online, and it's also, as all of us up here that are leaders and have our circle of influence, we have to use that influence to continue to do the right thing, to continue to not let these conversations die, because if they die, then the powers that be are comfortable with just letting the status quo remain. So we have to always fight against the status quo. And Professor Sagas, are you willing to send us out on your parting words? I know the last question was, how can you hear me? It is frozen right now. We can hear you, but the screen froze. So can you hear me? Oh, you're moving on.
You can hear me, I'm just going to say goodbye. I have a really bad connection at this point.
Okay. So Professor Sagas, thank you. If you can hear me, I appreciate your time and your expertise here today, and thank everybody for coming to this panel. And hopefully this is just the beginning of many conversations as we continue to fight for equity in everything, not just healthcare.
Just real quick, thank you guys for coming. If you're hungry, there are chicken and steak and vegetarian burritos and chips. Yeah, great. Hey!
All right, I gotta run.
Yes, please do.
I'm glad that everything worked out because tell that, make sure they stay.
Will you take a picture of that?
Make sure you all have each other's contact information. So that way.
Oh, we're not happy. Last I checked.
Yes.
What picture?
Yeah, we take a picture with the camera.
Even me?
Yes.
Even you.
Thank you so much.